In this video, I will highlight certain topics from Chapter 1, which is our Intro to Clinical Psychology chapter. Just as a reminder, these videos are not comprehensively covering the chapter, so make sure you review the chapter by reading it before you do the quiz or the weekly response. So this class is called Intro to Clinical Psychology, so a good place to start is to talk about what is clinical psychology. So if you want, you can pause the video here and kind of type a comment about what you kind of generally think clinical psychology is. There are a lot of different definitions that you'll see in the textbook, but generally speaking, clinical psychology aims to study, assess, and treat people with psychological problems or disorders. And so this is still quite broad, and as you can imagine, this has a lot of overlap with the fields of medicine, social work, sociology, nursing, counseling. And we'll talk in a moment about how there are actually a variety of different careers and career paths that you can take to become a psychotherapist. But this course will be specifically focused on clinical psychology, which is essentially the academic discipline of better understanding psychological problems. So something that's unique to being a clinical psychologist compared to, say, a psychotherapist with a master's degree is that the training is going to involve this rigorous study of psychological theories. Because at its heart, clinical psychology is fundamentally about applying what we know from psychological research into developing better assessments and treatments and better just understanding of how psychological problems arise. And so what is unique about clinical psychology compared to other fields within psychology is that it's all about applied practice as well. So in cognitive psychology, we might be understanding how attention works, and that might lead us to better understand how something like ADHD functions. But clinical psychology is going to focus on how do we identify ADHD and how do we help people who have ADHD live a better life. And so in this way, we're trying to understand and improve these psychological facets of the human experience. And this can be across behavior, emotions, intellect, these different domains. And so in general, I also like to think of it as we're just essentially trying to better understand human psychology and then take what we know about psychology to help promote positive well-being. And so I imagine you're taking this course because you're interested in some sort of psychology-related clinical career. And there are actually a lot of different paths to careers that are related to clinical psychology. So, for example, you could become a clinical psychologist, and that would involve getting a doctorate degree, either a PhD or a PsyD, which is going to involve learning about kind of all these different psychological theories and how to apply them, as well as becoming trained to assess people, to provide psychotherapy, as well as other activities. But there's these other careers that also involve a lot of the same day-to-day activities as a clinical psychologist, even if the training and the path to get there is a bit different. So I highly encourage you to visit this section of the textbook. I'm not going to go into it as much detail as the textbook does, but it will be helpful in responding to your LaLima weekly written response this week. Yeah, but essentially I'll touch on a couple of these. So school psychologists do a lot of testing and assessment, but they're not going to be as involved in the development of those assessments. And they're not usually providing psychotherapy. They might provide some sort of counseling related to the academic setting, but it's more focused on academic functioning specifically. Social workers, as well as jumping down to marriage and family therapists and mental health counselors. So many of these careers involve getting a master's degree, and then the day-to-day work involves delivering individual psychotherapy. And so a lot of people, go into clinical psychology wanting to be therapists. And I often say, there are faster ways to become a therapist than becoming a clinical psychologist. So I think a social work degree is a great way to get training in delivering psychotherapy and working with people And you can actually even, open your own private practice and be a psychotherapist as a social worker or as with a marriage and family therapist degree or a mental health counselor degree. What you're not going to be trained in is as much assessment. So that is how to kind of identify and understand where the disorder is coming from and how to do different intellectual or cognitive assessments or neuropsychological assessments. There's also less opportunities to be involved in research or like the development of new treatments. And in terms of career, there's just like a different career opportunities involved, which we'll get into throughout the class. And then the last one I want to touch on is psychiatrists. So, to the public, a lot of people mix up clinical psychologists and psychiatrists. They both are referred to as doctor, but they're actually very different. So a psychiatrist is a medical doctor. So they go to a medical school. They actually get training in general medicine before they even start any specialized training related to psychology. And in practice, a lot of psychiatrists are focused on the biological underpinnings of mental health concerns. So this might be pharmacological or medication-based treatments or other biological treatments. There are some psychiatrists who deliver psychotherapy, but it's actually quite rare, especially kind of increasingly now because there's such a shortage of psychiatrists that when there is a psychiatrist, they kind of end up having to be in the role of delivering biological-based treatments. So the path to become a psychiatrist is very different than a clinical psychologist, so they often work in partnership with each other. And then I just put other on here because there are many other psychology-related careers or helping profession-related careers that are not listed here, but that are highly related to clinical psychology. So you can go to nursing school and become a psychiatric nurse practitioner, for example, and deliver psychotherapy, just to name one example. So I encourage you to visit this section of the textbook and think about this when you're forming your response on the ALIMA. So today we're going to also talk about the 3 primary models of graduate training in clinical psychology. And we're talking about this for 2 different reasons. So one is that it's helpful to know what the path might be, what the programs look like if you're considering a career in this area. But 2, it also helps us understand the history of clinical psychology, as well as where different people in the field are coming from in terms of their theoretical orientation. So first, we're going to talk about the Boulder model. This is the scientist practitioner model, also known as the Boulder model. So the Boulder model takes a 2-pronged approach to training. It says that we need to focus on both practice, so be receiving training in applying clinical methods such as assessment, psychotherapy, as well as research. So we need to be able to study, evaluate the field scientifically, understand the theories, and to kind of push the field forward. So the Boulder model really focuses on having both components. And so this model originated from a conference that was held in 1949. And I want you to kind of keep this in your mind for when you're visiting chapter 2. This is right after World War II, and there were a lot of different shifts in how the US was looking at mental health. And so the Boulder Conference was intended to just standardize graduate education and say, like, we need programs to follow a certain protocol so that we know that when students are being trained as clinical psychologists, they're meeting certain standards. So most programs in clinical psychology still follow the Boulder model. So our program here at UH follows the Boulder model. And again, the overall goal is to produce clinical psychologists who are well-versed in how to conduct research, they can understand previous research, and they can apply this knowledge in the field. So over time, the Boulder model began to receive some criticisms. So it was noted that there was a much greater need for providers than was being met by graduate programs. So to get a PhD, it takes several years. Each student has to develop a novel dissertation topic. There's a lot of research involved. And so they're saying, it's taking too long. Like we're not getting enough providers in the community. And so there's also this question of, if somebody just wants to be a practice-oriented clinical psychologist, why do they need to get all of this research training? Again, it's not an efficient way to produce clinical psychologists. And so jumping ahead a couple decades, there was another Colorado conference. This was in Vail, Colorado, so it's referred to as the Vail model. This one's also referred to as the practitioner scholar model. And so this new model has a lot of differences from the Boulder model. So they cut out some of the requirements for research training, and then you get additional training in the development of applied clinical skills. And this is how the PsyD degree came about. So here in Hawaii, we have Chaminade University as well as Hawaii Pacific University. Both of them have relatively new PsyD program options. So these are degrees where you're getting a doctorate in clinical psychology that's more practice-oriented and less research-focused. So these PsyD programs have gotten pretty popular over time. There aren't as many. There are far more PhD programs, but PsyD programs accept many more students. And so nowadays, it's about equal the number of graduates each year that are receiving PsyDs and PhDs. And so some people think a PsyD program is a way to kind of skip all the research. That's not totally true. Most programs require at least some degree of training in research methods and statistics. So the reason why it's called a practitioner scholar model is because you're learning how to be a practitioner as well as a scholar. So it's more focused on how to read previous research instead of conducting new research. So these programs that follow the practitioner scholar model, they often have higher acceptance rates than PhD programs, so they're easier to get into. They have lower GRE scores and GPAs. However, one of the big downsides is that there are less opportunities for funding. So many of the Boulder model programs offer funding. So UH will only accept students if they know they can fund us. So that looks like getting like basically a job at the university, and you don't have to pay for your graduate training, because otherwise some of the PsyD programs can end up being hundreds of thousands of dollars in student loans. These practitioner scholar models also have a bit lower success rates for placement in pre-doctoral internships, but they take less time to complete. So in general, there's kind of these pros and cons to weigh when you're looking at these graduate programs. More recently, we have the clinical scientist model. And so this arose due to concerns that, we're actually cutting out too much research training. We really need to emphasize the scientific method, and we need to maintain clinical psychology as a truly academic discipline. As I noted, there are many paths to becoming a psychotherapist. And so people coming from this angle are saying clinical psychologists need to be the ones scientifically studying the field of clinical psychology. And if somebody purely wants to be a practitioner, then there are other routes for them. So, getting a social work degree or a marriage and family therapy degree. So this came about in the 90s, and it was really focused on this idea that we, as clinical psychologists, need to have a focus on scientific thinking, and that it really is like a key issue in our field that there are now more programs and more clinical psychologists that do not have this training in scientific thinking. And so since this kind of movement started, several graduate training programs have changed their names to, instead of calling themselves the Boulder model, they now say they're clinical scientists, and really boost their research requirements for students to ensure that they're really getting rigorous training in the psychological theory and research. And this has come up with UH. They haven't switched yet, but it's something that we're definitely discussing. So just as a side note, this conflict between researchers and practitioners and kind of people coming from the Boulder model versus the Vail model, it's ongoing within the field of clinical psychology. And you might be thinking to yourself, why does this matter? I'm not you might not be interested in like looking at these particular programs just yet. But this conflict is broader than just the different training paradigms, and it's something that will come up in this class. So within the field of clinical psychology, we have some people who are more research focused who are saying, you know, clinicians should only be using evidence-based practices. If we rely on clinical intuition and judgment, this is like applying pseudoscientific ideas, passing them off as actually helpful. You know, this idea that like anyone can just like become a therapist and do whatever they want. And it doesn't actually, there's no oversight into seeing that it actually is helpful. And so that on that side, the researchers are saying we need to have this training where people have like really good understanding of the fundamental theories, and evidence-based practice is like a key part of this. On the other hand, we have some clinicians might say, you know, researchers are doing their studies in settings that don't actually resemble clinical settings. So, you know, if you go run your treatment study at a hospital and you're only recruiting a certain population, it's not going to reflect what a community clinic looks like. And they might argue that you really need to develop this like clinical expertise in order to adjust treatment based on a client's particular needs. And so this kind of ongoing argument about what evidence-based practice is and the importance of therapist characteristics is something that we're going to go into more detail about later. So I just wanted to kind of keep that in mind, because thinking about where a psychologist comes from in terms of their training may affect kind of which side they're on here. So we'll wrap up there for chapter 1. Feel free to put any comments if you have any questions or thoughts about any of these topics.